Hi, I'm Elena Agapie from UC Irvine, and on behalf of my co-authors, I'm excited to present our paper on a longitudinal goal setting model in mental health. Setting goals is a critical component of effective health interventions and engaging with many behaviors, including eating healthy, exercising, or managing mental health. And most technologies support some form of goal setting or monitoring of goals. However, many of these tools focus on easily quantifiable goals that are often static and do not change much over time. But many of the goals people set through their everyday life are more complex and abstract, including relationship management, being happy, living healthy. In this research, we investigate how people manage abstract and complex goals, specifically by studying the goals people set for managing mental health. Goal setting is a critical part of many evidence-based psychosocial therapies. They can help people engage in activities that they find pleasurable, which will lead to lowering depression symptoms. Mental health therapists are trained in setting goals with clients, offering an excellent opportunity to understand how people's goals evolve over time. So in this work, we answer the question, how do mental health therapists and clients set goals over time during therapy sessions? We conducted an interview with 7 mental health therapists and 11 clients who engage in therapy over 9 sessions. In our findings, we present a 3-stage model for setting goals and the strategies that helped our clients and therapists use goal setting, including selecting, simplifying, and adjusting goals. And we discuss how technology can better support goal setting. We find that participants manage multiple goals at the same time related to employment, relationships, building social connections, managing health conditions, exercising, doing chores, and many more. The goals were fairly complex and not easy to resolve quickly. Many goals were similarly important at the same time, making it difficult to choose what goals to address at any given time. So clients and therapists went through a process of reflection to understand the client's problems and how they can be addressed through taking action. We present examples from the therapist's perspective of the process, and you can read more about the client's perspective in the paper, as well as more the different reflective practices they use. Because participants have multiple goals and problems at the same time, clients and therapists went through a process of selection between goals to focus on one goal at a time. For example, through this process, therapists and clients focus on dialogic reflection, drawing connections between data about the client and their current situation. This was done by aligning goals to the client's values and with what the client had control over. For example, a therapist working with a client said, kids stopped talking to her, refused to let her see her grandkids. She had no control, couldn't change the situation. Now, what we worked on was a lot of stress management, things you could do. So that helps. Choosing a problem to focus on also relied on the therapist helping the client reflect on the past and the future. The therapist helped bring up issues or goals that the client avoided addressing. He has problems in all categories: loneliness, feeling too sedentary, diet, and he always picks those. But then it feels like we're talking around the bigger issues of should I leave my wife or not? So the therapist would help surface past problems that they can then address. Therapists and clients anticipated difficult situations in the future that the client could address by taking future action. He's leaving town, I'm really anxious. And then we say, this is an important thing for us to prepare for. So we're trying to figure out alternative activities that bring the same joy. Once therapists and clients choose among the many problems or goals that the client has, during the sessions, they try to simplify the goal to the point that the client can have a clear set of actions that they can take. To simplify complex problems to actionable goals, therapists and clients break down problems and tease apart what's achievable. And that can take weeks to understand. Therapists will also help reinterpret problems through inquiry, leading to transformational reflection. They work together to understand how client problems manifest. For example, the therapist learned from a client, oh, I tend to go to my bedroom, laying on my bed, and then I realized that I've been on my bed for several hours. So their intent here was to get the client more engaged in activity. The therapist made use of prior information about the client to recommend. They've mentioned that they really enjoyed walking, gardening, being outside, things like that. So we'll talk about what could you do instead of going into your room and laying down. Next, therapists and clients would adjust goals based on the client's skills, anticipating barriers that can come in the way or reinterpreting current goals and practices. For example, the therapist would take multiple weeks to understand what the client is able to do on any given week. Based on learning about the client's skills, therapists would recommend courses of action, such as learning new skills. A lot of them, clients, are taking steps to do something maybe you've never done before. A woman, she had never told anyone she was mad at them. Her whole life been passive and never said a word to somebody like, I'm mad at you. So then they would work on acquiring a skill that would help the client practice that. Based on our findings on how people's goals evolve, we discussed the need for technologies to support people in engaging with multiple goals that are evolving. Technologies that are domain specific, like exercise, sleep, or mental health, apps could account for the different priorities that are competing in a person's life and support prioritizing different goals at different times, or integrating people's goals across different technologies. It's useful to incorporate techniques for reflection on the past and future actions to support the current goals by resurfacing goals avoided in the past or anticipating difficult situations and surfacing ways to address them. It can be useful for people if technology supports turning complex goals into concrete actions by guiding breaking down goals into different sub-goals or helping reinterpret situations. And finally, technology could support adjusting goals by understanding people's skills and adjusting goals to a variety of skills, reassessing goals, and supporting adjustment and re-engagement with goals after a period of pause. Thank you. We'd love to hear from you if you're interested in this work.